Hey everybody, it's Caitlin. Welcome back to CoronaChat. Today is Thursday, June 11th, and today I wanted to talk a little bit about school reopening. So in many countries, schools have been closed for months now, and classes, if they are happening, are online only. And this has caused lots and lots of problems for parents and caregivers, especially for those who are having to juggle working from home and taking care of young children and supervising virtual classrooms. It's a lot. And it's not been so great for kids either, right? Many children are missing their friends, and the constant disruption and uncertainty can be very hard on children, leading to nightmares, ongoing anxiety, and even regression in developmental milestones, right? Lots of parents and caregivers have been reporting that their kids are starting to wet the bed again, or, want to sleep in their parents' bed, or have other kind of out of character behavior, including increased aggression. And these are all ways that children commonly express distress, and we're seeing a lot of it on the rise. And for some children, school closures have meant that they're not getting to breakfast and lunch that they're fed at school, which could mean that maybe they're only getting one meal a day or barely eating at all. School closures are also causing all kinds of disparities and negative effects. There's lots of learning impact, right? Kids in vulnerable populations, those who are poor, those who are rural, kids with disabilities, are disproportionately negatively impacted by the fact that schools are closed, right? And lots of kids, yes, classrooms have gone online, but lots of kids don't have access to consistent internet at home. So we're seeing lots and lots of disparities in terms of learning right now. And there have also been concerns voiced that with kids home all day, those who live in households that are not particularly safe, whether that's because of physical, verbal, or sexual abuse, those kids could really be at risk. So, in many countries, schools were closed really early in the pandemic when we didn't know much about how the coronavirus spread, right? There was a lot of concern among policymakers and among the general public that children could be vectors of disease, despite many experts saying that actually this probably was not the case and that school closures probably were not necessary. But out of an abundance of caution, many decision makers decided to close schools preemptively until we knew more. So now that the pandemic's been raging for several months, we actually do know a little bit more about the virus that causes COVID-19, and it seems like children are not particularly affected by COVID, and that when they do get sick, their symptoms are generally mild. That said, some kids do get very sick, as we've seen with the increase in a Kawasaki-like syndrome after some children recover from COVID-19, which we've talked about on CoronaChat before. But, this seems to be a kind of small minority of kids and not every kid that's getting infected with coronavirus. We still don't have a great understanding about the role that children play in transmission of the virus, but we probably won't know that until we have wide-scale testing of everyone, even those who don't have any symptoms. And so far, there have been very few outbreaks linked to schools, but this, of course, could be because schools have largely been closed all over the world. But schools play a really important function in everyday life, right? Schools help kids learn and grow, and they have these important childcare and public health functions. It seems like schools can be made safe. If it seems like schools can be made safe, then there are good reasons for us to try to reopen them. So the World Health Organization, UNICEF, and the Centers for Disease Control and Prevention are all giving really consistent advice about school reopening. And they suggest that decisions should be made locally based on things like whether the trend in COVID cases is flat or declining, whether there's available public health capacity to test, contact trace, and isolate affected individuals, and whether there are enough school staff who aren't at risk of developing life-threatening complications if they are to become sick, for example, because of their age or because of their underlying medical conditions. Right? These agencies are also giving really consistent guidance about how schools should operate once they start to reopen. And all of this should sound pretty familiar if you've been keeping up with the general coronavirus recommendations. So, students, teachers, and staff should all consider wearing masks or cloth face coverings if possible. Everyone should be encouraged to wash their hands and use sanitizer often, and there should be signs posted to help remind everyone to wash their hands, cover their mouth if they cough or sneeze, and generally practice good hygiene. High-touch surfaces should be cleaned often, and the school environment should generally be cleaned and disinfected regularly. Now, students and teachers need to be able to social distance, so desks might need to be spread out, class sizes might need to be reduced to make sure that there's actually enough physical space to meet social distancing requirements, right? Instead of going to the school cafeteria, kids might have to eat lunch at their desks to make sure that there's enough space. But perhaps most importantly, everyone should be told to stay home if they are feeling even a little bit unwell. Now, normally we put a lot of emphasis on attendance, right? We maybe have awards for the kids with the best attendance. We call home if the child is not coming into school, and there are penalties for missing too many days of school or for missing school without a doctor's note. All of these public health agencies are saying, right now we actually need to be really flexible about attendance and let kids stay home if they're feeling sick. Let people who work in schools stay home if they're sick, so they don't risk getting somebody else or lots of other people in the school community sick, right? Now, lots of these things could be difficult to carry out, right? Picture trying to get a room full of first graders to wear a mask, but we need to do the best that we can to try to make sure that we can keep the school environment as safe as possible so that we can reopen. All of this costs money, right? It's estimated that the cost of making these changes will be around 1.8 million US dollars per school district, at least here in the US. I have not yet seen numbers for other countries, but this is just to give a ballpark, right? This is a lot of money, and it's money that most schools don't have, right? And so we're going to need to do some really creative thinking about how to make sure that schools can do what they need to be able to keep kids and families safe. So, this is going to require thinking about, are there ways to expand school budgets, maybe reallocate funds? Many towns' Board of Education meetings are now online. And so if you live in a town, in a school district where, you have a school Board of Education that makes decisions about funding, and they're doing their meetings online, you might want to try to call into that meeting and be involved in some of those budget discussions. Similarly, if you're involved in a charter school or private school community, being involved in those budget decisions and making sure that your voice is heard to the people who are going to make those decisions for the school community can be really helpful. Another thing that might be thinking creatively about what PTAs can do, what kinds of grants might be available. Obviously all of this money can't just come from a tax base, so we're going to need to be really creative in thinking about how we make sure that schools have what they need in the months to come. So, so that they can get kids back to school safely and feasibly in a financially sustainable way in the long run. So that's our show for tonight. Thanks so much for tuning in. And as always, if you've got questions, comments, drop them below, send us a note, and we'll see you all back here tomorrow night on CoronaChat. Thanks, everyone. Stay safe, take care of each other, and remember, we're all in this together.